I'm always striving to use the materials in my office that are the most tested. I'm making sure that there's long-term data on those things. So Straumann, which I use for my implant system, and other materials that I order for my periodontal surgery, they are, I believe, the top in their field. So I'm using the materials that I know that I would use in myself or my mom or my brother. They're helping me provide that level of care to the patient because I'm using the material that's going to give me the outcome that I'm looking for. This year marks 5 years of my practice. A couple of weeks ago, actually, I was doing a surgery and just having that feeling of like this was just an idea at some point. I had these visions and values of what I wanted to bring to the patients that need my care, and I wanted to do that in the right environment. When I started, I really slowly began building that one patient at a time. And to think that 5 years have gone by and we went from having 0 patients to having all of these dedicated periodontal patients that have come for my treatment and for my expertise, it's a great feeling to be here. When I started my practice, my vision and goal was always to provide the highest standard of periodontal care in a calming and a comfortable environment. I think that I have always stayed true to that. Whenever I took on new team members or we worked with new doctors, I always made sure that they understood that that was at the core of my practice. I always want to make sure that I'm listening to my patients and making sure that I'm providing them the experience that they want with the feedback that I've gotten from them, because they are the ones that are the most important. As a periodontist, I want to be at the forefront of new technology, new techniques, and I'm just excited just to see how that evolves. I'm really proud that I was able to take this idea and bring it to reality, and I'm living in it every single day. Every time I walk into my office, just the sense of like, this is my practice. I get to do the treatments that I want to do. I get to treat patients the way I want to, and that is just like a really nice freedom that you feel. And I think as a female, especially business owner, it's just important to feel that way. Women have this ability to just be so dedicated and so persistent in achieving, their goals or their dreams. Seeing other women before me do these things is really motivating, and I hope I can be motivating and inspiring for, not only my daughter, but other women dentists or physicians or anybody that wants to achieve something. Our practice is at the forefront of technology, microsurgery, and periodontal surgery. In order for us to provide that level of care and service for our patients, we have partnered with the top companies in their fields. I've worked with SurfCT to establish a very streamlined digital system in my practice, how we collect images for patients, how we store that information. I can record my surgeries through the microscope and then use that for education or use that for my referring doctors. And these things all were set up with the technology in our practice with SurfCT. I think that allows us to not have to focus on that so much because it's just done so easily. Then we can focus on what we really need to focus on, which is the care of the patient. I wanted the patients to come in and feel instantly at home and comfortable. Lots of patients have anxiety when it comes to surgery, whether they had a previous experience that didn't go well or just their own thoughts about what to expect. I'm going to be able to sit down with you and take, an hour, 2 hours, just to really figure out, A, who you are as a person, what are your goals, what are your challenges. Everybody is individual, everyone has their own unique needs, and I try to tailor my exam and my discussion with you based on the needs that you have. If you feel that comfort and you feel that connection with me and you trust me, then I think you and I are going to be able to get to that place together that we both want to be, which is finding a solution to the problem that you might have. Patients find that when they have procedures done with the microscope, they have a significantly less postoperative pain with the procedure. They always tell me, wow, like I didn't have much swelling. I didn't have much pain after this procedure. I really, really love seeing the patients smile and tell me that they just had such a great experience. I love what I do so much that connecting with them and seeing that joy in their eyes, that's everything to me. I'm the 4th generation female dentist in my family. Growing up with both parents that are dentists and then having this lineage of dentistry, I actually didn't really want to do dentistry initially. I thought, okay, maybe I would go into the medical field, and when I was thinking that, I was always drawn to surgery. When I made the decision to go into dentistry, I knew that it was the right field for me because A, I was working with my hands, which I love to do. B, I was managing the patient and helping them with some sort of problem. And then quickly I realized that general dentistry was not for me, and I really wanted to pursue surgery because it was challenging, it was exciting. I love that I come here every day just looking forward to seeing my patients and knowing that I can connect with them also on a personal level. Once I speak with them, I already am formulating a plan in my mind of where I'm going and how I can help them. I just get so excited to take them through this journey with me to give them the outcome that they're looking for. Aside from Dr. Prokopets, I am a mom, which is my other job, and I enjoy every moment of that. It is just as challenging as what I do here in the office, but it's super rewarding. They are my pride and joy, and I enjoy every moment of my time with them.
I had a traumatic injury fall when I was in elementary school. I was in 1st grade, knocked my teeth out. So from that point on, I had nothing but fake teeth after set of fake teeth after set of fake teeth. I had multiple dental implants and grafts, bone grafts, and cosmetically, I hated my smile. I had been going to a regular dentist, and I would start to ask him about what my options were. And then he told me that Dr. Prokopets was a friend and colleague of his, and she was absolutely amazing. And I thought, well, what can it hurt to get a consultation? She was so warm and engaging and gave me all kinds of confidence. Like what I had wasn't a big deal, but if I wanted to change it, she could help. She just completely put me at ease. There was never a hesitation or a question whether or not I was going to go through with it or if I was going to use her to go through with it. Not to mention the technology she had to be able to put my smile up on her screen and then edit things and show me. I'm never going to have the smile that I was born with, that God gave me, because it got messed up at a young age. But I can't imagine that what I was born with would be better than what I have. I don't mean that to sound like I'm bragging, but I've never been as happy with my smile as I am since her procedures, without a doubt. My son was born in February, and I decided to breastfeed. They say that, it's going to be uncomfortable, but after a month, he wasn't gaining enough weight, so we kept going back for weight checks. But I knew that when I pumped, I had enough. There was no reason that we should have an issue, but it was so ungodly painful that I cried every single time I had to feed him. I went to see his lactation consultant, and they told me that they think he might have had a tongue tie, that it was pretty much borderline for them to recommend that he needed a procedure done, but that I should go visit a pediatric dentist. So I did a lot of research, and I just had remembered Dr. Prokopets. She had mentioned something on Instagram that she had done a tongue tie procedure for her daughter. We came in, and she was as gentle and sweet, loved on my baby so much. It was so heartwarming just to see how compassionate and sweet she was towards him. And she evaluated him and said that she did believe that he had a lip and tongue tie, and that she knows how painful it is for me, and that she would want to treat him. Handing a 2-month-old to have a procedure done is very nerve-wracking and scary and intimidating, but I had absolutely no problem handing Dr. Prokopets my son. It was probably 2 minutes later she brought him back into me and let me nurse him, and it was the first pain-free nursing that I had had since the hospital.
I was referred to Dr. Eugenia Prokopets because I had receding gums. She was touted as the best, and the referral did not disappoint. Coming to see Dr. Prokopets in her office was an exceptional customer experience. I walked in and they know my name and they were prepared to see me. Once I was actually back there and met Dr. Prokopets, it was as though we had been friends for a long time. It was very casual and she was knowledgeable about all the things and reasons that I was there initially, and I felt very much at ease even from the initial consult. Dr. Prokopets is truly stellar in terms of the care that I received. I felt like I was the only patient she had. And while I know that's not true, it was amazing to have that kind of rapport with a surgeon. I would do it again and feel really strongly that I'd be taken care of. I am a marketing consultant. I own my own independent marketing communications agency. I love doing my job. I want to feel comfortable when I'm doing these things and meeting people. This is really important for me to feel confident when I smile in photos and with folks. To know that you have a partner in your corner, it's tremendous. It's really priceless. You can't put a value on that.